Top 10 Killer Diseases in the Philippines. We will dive into the top 10 killer diseases in the Philippines, examining their causes, impacts, and implications for public health in the country. 1. Cardiovascular diseases. Cardiovascular diseases, including heart disease and stroke, rank as the leading cause of death in the Philippines. Risk factors such as hypertension, diabetes, obesity, and unhealthy lifestyle choices contribute to the high prevalence of cardiovascular diseases among Filipinos. 2. Cancer. Cancer is the second leading cause of death in the Philippines, with lung cancer, breast cancer, and colorectal cancer being among the most prevalent types. Factors such as tobacco use, unhealthy diet, environmental pollutants, and limited access to cancer screening and treatment contribute to the burden of cancer in the country. 3. Respiratory diseases. Respiratory diseases, including chronic obstructive pulmonary disease, COPD, and pneumonia, represent a significant health burden. Factors such as air pollution, tobacco smoke exposure, and inadequate healthcare infrastructure contribute to the high prevalence of respiratory diseases. 4. Diabetes. Diabetes is a growing health concern, with both type 1 and type 2 diabetes posing significant challenges to public health. Risk factors such as obesity, sedentary lifestyle, unhealthy diet, and genetic predisposition contribute to the increasing prevalence of diabetes among Filipinos. 5. Tuberculosis, TB. Tuberculosis remains a major public health threat, with high prevalence rates and challenges in diagnosis and treatment. Factors such as overcrowded living conditions, poor nutrition, limited access to healthcare services, and drug-resistant strains of TB contribute to the persistence of the disease. 6. Kidney diseases. Chronic kidney disease, CKD, is a significant health concern in the Philippines, with risk factors such as hypertension, diabetes, and unhealthy lifestyle choices contributing to its high prevalence. Limited access to preventive services, late diagnosis, and barriers to kidney transplantation and dialysis exacerbate the burden of kidney diseases in the country. 7. Infectious diseases. Infectious diseases such as pneumonia, influenza, dengue fever, and HIV/AIDS continue to pose significant health threats in the Philippines. Factors such as poor sanitation, inadequate healthcare infrastructure, and climate change contribute to the spread of infectious diseases. 8. Liver diseases. Liver diseases, including hepatitis B and liver cirrhosis, are prevalent in the Philippines, with risk factors such as alcohol consumption, viral infections, and unhealthy lifestyle choices contributing to their high prevalence. Limited access to hepatitis screening and treatment services, as well as social stigma associated with liver diseases, pose challenges to effective prevention and management. 9. Dengue fever. Dengue fever is a significant mosquito-borne viral disease, with outbreaks occurring regularly, particularly during the rainy season. Factors such as inadequate vector control measures, urbanization, and climate change contribute to the transmission of dengue fever. 10. Maternal and neonatal conditions. Maternal and neonatal conditions, including complications during pregnancy and childbirth, remain significant contributors to maternal and infant mortality. Factors such as limited access to prenatal care, skilled birth attendants, and emergency obstetric services contribute to the high maternal and neonatal mortality rates. If you find this helpful, make sure to hit the subscribe button.